Swinburne University of Technology.
Hello everybody. Welcome to this interview today. My name is Dr. Ben Bullock, and today I'm talking to Associate Professor Steve Theiler, who is going to talk to us a little bit about clinical hypnosis and the techniques that he uses in his private practice as a psychologist and counsellor. Welcome, Steve.
G'day, Ben.
Can you first of all maybe give us a bit of a background on what you do, how you use hypnosis with your clients, and how often you've been doing it for?
Okay. Well, keep me on track if I go off the question. So I'm a clinical and counselling psychologist, and I've been working for about 20 years. And I've found that my training in hypnosis has been really helpful in deepening the kind of work that I'm doing in my counselling. So for example, with clients that come to see me that might have difficulty with anxiety, hypnosis just helps me to really reinforce areas like becoming more calm, being able to feel like they're more in control, and depending on the specific kind of instance, if they've got a particular fear of something, just to help to lessen that fear and that anxiety.
Okay. Would you say that so you mentioned anxiety, is that one of the conditions that is particularly suitable to using hypnosis, or are all psychological conditions suitable for using hypnosis?
Yeah, it's a good question. Well, I find anxiety really, that hypnosis is really helpful with anxiety, but there are particular disorders and issues where I wouldn't be using hypnosis. So,
such as?
Well, if someone's got clinical levels of depression, if they're quite seriously depressed, it's contraindicated for using hypnosis. And also if someone's got some of the more psychotic disorders like schizophrenia, to take someone into what I would call an altered state, when they're already in a state which can have a crisis, a delusional sort of crisis, again that wouldn't be suitable to use hypnosis.
Okay. And you mentioned it is an altered state. For those people who perhaps haven't been hypnotised,
yeah,
how would you describe that hypnotic state to them?
Yeah, you are coming up with good questions.
That's my job.
Yeah. The altered state, which, contrary to what maybe a lot of people think, is not really that different to where you might be just completely absorbed in reading a really good novel, or going to a movie like Lord of the Rings and you all of a sudden forget about anyone else in the theatre and you're just completely involved, absorbed in whatever it is that's happening for you, whether it be the book or the movie. So really it's a state where there's not a lot of conscious or rational thinking. It's more of just a state where you're feeling just calm and absorbed in whatever is happening for you at that point in time.
Okay. So absorption is a way to describe what the hypnotic state is, a state of deep absorption in whatever you're doing.
Yeah, yeah.
And that, I guess, is why you might use a swinging fob watch to induce the hypnotic state. Or am I showing my biases there? That might be a little bit old-fashioned. How do you induce a hypnotic state?
Yeah, well, the fob watch, or the looking at a finger, or getting someone to focus on a light on a wall, is one of the methods that you may use, and it's really to get someone's attention to focus on just one thing, and at the same time you bring in another, if you like, narrative or another set of instructions that are happening when someone is very focused on the light, the watch. It can be a mandala spinning around, it might be a candle, it might be just a relaxation technique. So for me, I find it usually helpful to get someone into a relaxed state. So I usually take them into a fairly quick kind of body relaxation or a more mindfulness state. And when I can tell that they're in that absorbed and relaxed state, then I'll start putting in what's called suggestions, which is really just suggesting to someone positive and, if you like, clinical kinds of statements. And what I mean by clinical is if they're anxious, something that's related to helping their anxiety. And putting those suggestions in, we don't fully understand how this mechanism works, but there's something about bypassing our rational conscious mind and putting in a suggestion that seems to have quite profound and clinical applications in psychology.
Okay, interesting. So is everyone easily hypnotizable, or are there different levels of hypnotizability? I tend to think of myself as someone who's quite difficult to hypnotize. And what are some of the signs you look for with a client in terms of perhaps deciding that hypnosis might be suitable, particularly suitable, I should say, for one person or another? Yeah.
Well, if we put aside some of those examples of schizophrenia or major depression, if we've screened for sort of contraindications, well then normally we would give people some sort of education about what hypnosis is, and that there will be a slight feeling that they'll go into this altered sort of state of consciousness that's where they're feeling relaxed. Because sometimes for some people that's a little bit disconcerting, that they're concerned about losing control, because there's been a lot of, you know, the TV sorts of programs and so forth that make people a little bit nervous that they're going to, you know, cluck like a chicken or walk around doing things that they would not normally want to do.
Yep.
So once there's been that sort of education, then I just gently take someone into what's called a light trance, and you can talk to them. Usually I like clients to have their eyes closed, but some people don't like to close their eyes, but normally it does help with your absorption if you can just get into a relaxed state and close your eyes. So once I do that, you can tell whether someone's, you know, moving into that state, and also I ask them how they're going and whether they're feeling relaxed, and for them to report back to me how that experience is going. So that's on one level, but on another level there are measures. One of them is called the Stanford Hypnotic scale, and that gives you a measure of how hypnotizable someone is.
What are some of the questions or elements of that scale?
Well, it's looking into all the aspects of the senses. So it's looking at whether someone is able to lose the sense of touch in a sort of, let's say, their hand or their finger, so we can see whether we can bring about some sort of numbing of the hand, which might be then useful in terms of a medical condition. We also might ask them or put a suggestion in there that they might hear something that physically we haven't actually made that sound, or whether they can hear it, whether they can visualize something that isn't actually physically there, and even whether they have amnesia. We can say that when you come out of this particular trance, you won't remember such and such. Yeah. And so we have these different measures, and they all have items we tick off, and at the end we get a score, and we can see how then hypnotizable someone is, and they normally fall into a bell curve.
Right, okay. So some people, there are differences between people's level of hypnotizability.
Yes.
I imagine, from what you're saying, I imagine that trust in the therapist is actually quite an important thing as well, because if the client doesn't trust the therapist implicitly, then they're not going to allow themselves to go into a relaxed state.
Yeah, absolutely.
So I guess building that rapport with them and trust is really important. It
is really important, and you brought up about counselling. I see that, and being a clinical and counselling psychologist, that's really a fundamental ingredient as well, to make sure that you are continually building that trust, not taking it taking advantage of that or taking it for granted. And I think the same goes for hypnosis, and probably even more so, because often people are concerned about, well, what will happen to me and what are you going to do to me? And it's really alleviating those on one level by giving them education about it, but on another level it's really conveying that you are hopefully a trustworthy practitioner.
Okay. You also mentioned earlier that people can worry that they're going to get told to or get induced into a hypnotic state to walk around like a chicken and cluck like a chicken. Is that one of the big myths surrounding hypnosis? And are there other myths that you, as a clinical hypnotist, that you would like to dispel today?
Well, I think television hasn't done clinical hypnosis any favours with doing that. What normally happens is that the hypnotist in those television programs is fairly expert at being able to discern whether someone is hypnotizable or not. Sometimes there's already been a screening so that people who are going to be selected are highly hypnotizable. And I think it's really a misuse of a vulnerability that people have.
So you're talking about those stage hypnotists who get.
So I'm talking about those stage hypnotists that get
and characters on TV.
Yeah, that get people up, and then even see them in serials, some sort of serials on TV. And I don't think that does the clinical hypnosis any good service, because it brings about then that kind of fear that, well, what will happen to me? What will he do? Or what will she do? And that is not helpful, because I'm aware of some really excellent uses that you can put hypnosis to in reducing anxiety, reducing fears, really helping to reinforce and enhance people's lives with good suggestions that they're willingly wanting to take on board. But it's not something you can just give someone homework to do and they'll necessarily adhere to it. But even something like quitting smoking, people want to quit smoking, and yet if I just tell you to quit smoking, you might go, well, look, I've tried this and I've tried that. But hypnosis really deepens and enhances the treatment of helping people to be motivated to give up whatever it is, and smoking's a good example. Yeah,
so it sounds like you need to take, so the techniques that people learn within these counselling and hypnosis sessions are techniques they can take home and use on themselves away from the counselling session, is that correct?
That's right. And I usually give my clients a digital recording of the session so that there's no mystique about it. They can go home and they can then listen to that recording. And let's say in the case of wanting to relax, they're feeling quite stressed and life is stressful for them, just to be able to take a recording home and listen to it before they go to sleep, is something that I've found really helpful. Okay. And
but can they actually induce the hypnotic state themselves? And without the use of the tape, can you teach people to do it themselves? Or, in actual fact, a sub-question of that is, have you ever tried to hypnotise yourself, and can you hypnotise yourself, and why or why not?
Well, to answer that question first, yes, you can hypnotise yourself, and I do hypnotise myself. And I find these days, for instance, I do Pilates and I do yoga, and it's really stretching me at the moment. And sometimes I get really quite sore legs And so I actually get woken up in the night with pain in my leg. And I'm able to just take that pain away instantly by almost a self-hypnotic command, just that you're not going to feel the pain anymore.
Right.
So I use it. I do my own self-hypnosis in terms of relaxation, and I use it for all sorts of things.
Okay.
And so really ultimately, that's the goal of any therapy, is to have people be able to do this themselves, whether it be clinical counselling, hypnosis. You really want people to become empowered so they can learn a technique and then it just becomes second nature that they use. And in the area of pain management, anxiety, I just find that that's mostly the most applicable areas in my sort of work. That is helpful, and also just reinforcing some of those deeper self-affirming and in psychology we call them kind of ego strengths that might be developed, and hypnosis is one technique that can help with that.
Okay, fantastic. Well, thank you so much for your insight today, Steve, into
Pleasure.
hypnosis. I hope everyone has found something useful or interesting out of today's talk with Steve. And if you have any questions, if anyone has any questions about hypnosis, you can certainly contact myself, and if I know the answer, I can answer it for you, or I can pass it on to Steve and he can perhaps answer any questions you have about hypnosis. Bye for now.
This has been a Swinburne production.